He started at 285 pounds, was depressed, was anxious. He was drinking way too much alcohol, eating way too much fast food. And this was just 5 years ago. Internally, he was probably miserable. And when we dialed everything in, we got his thyroid optimized, we got his testosterone optimized, we started him on a GLP-1 peptide, and he really started using those tools to his advantage in the sense that it gave him motivation and drive to get out there, to exercise 5 days a week, to start lifting weights, to change up his diet. And honestly, he's like my most successful transformation because I just like the difference that I have seen in him, in his mindset, in his faith, in his physical health is just insane. I am a nurse practitioner and I own Redline Health and Wellness. This is a practice that focuses on hormone replacement therapy and metabolic health. If you're coming to me, it's because you don't feel well and you're not getting any answers anywhere else. I do a lot of deep dives into blood work, and I listen to my patients, and we don't see much of that in healthcare anymore. So when you work with me in my practice, that is what we're doing. Yes, we focus a lot on hormones and lifestyle and weight loss, but those are the foundational things. And if we do not get those under control, nothing else gets better. Primarily, I help women and men who are in, midlife, ages 30 to 55, who are going through hormonal changes, whether that be perimenopause, menopause, or even hormonal changes while they're still menstruating, like PCOS or vitamin deficiencies, those who need to lose weight and just feel better overall. So this looks very different for men and women, but starting with men, most of the time when a man comes to me, they're already feeling low energy. They feel like they can't lose weight. They feel like they can't gain muscle. They are feeling depressed or anxious, or maybe not necessarily depressed, but more so, low mood in general, or very irritable. They might be having problems in their marriage, or they might be, super impatient with their children and just no drive for life anymore. They might be suffering at work or not performing at work to their best abilities. They might be having trouble with weight gain or losing weight. They might be having erectile dysfunction or just the simple things like joint pains and trouble sleeping and things like that. When a woman comes to me, usually she is experiencing fatigue throughout the day. She's experiencing a low drive for life. She's getting frustrated very easily, irritable, whether that be with her husband or her kids or her colleagues at work. And she has reduced stress tolerance. She's not sleeping very well. She's having joint pains. Like I said, low energy. That's kind of, some women are also having extremely heavy periods and menstrual irregularities. And they're not really getting answers from anybody else about what's going on. So that's what we deal with here and what we help people with. When someone leaves from our first visit, I want them to feel supported. I want them to feel heard and like somebody finally understands and somebody's going to help them, or somebody's going to give them answers to the issues that they've likely dealt with for years. And I want them to feel comfortable and excited about the treatment the treatment plan that they're about to embark on. I named my practice Redline because my husband's a firefighter, and obviously the big thing for firefighters is, the red line to support firefighters. And honestly, he was a lot of the reason why I opened my own practice, because he was going through very similar symptoms 5 years ago after we had both of our kids. And he was struggling with his weight. He was struggling with depression. He was having issues at work, and he was just not at his optimal, and he was only 30 years old. And he started testosterone replacement therapy, and eventually he started peptide therapy, and he became a new person. And I want to help others do that. I want to help others be able to change their lives, change their marriage, change their relationship with their kids. And that's exactly why I started this. So that's where Redline came from. So as a child, I always wanted to be in the healthcare field. I've always loved the thought of helping people. And my sister was a nurse. My father had a lot of medical difficulties as, in our childhood. And I honestly saw a lot of complications from his health. And I felt like he wasn't supported through his health concerns as much as he should have been. And that really ultimately made me want to be a nurse practitioner, because I feel like he had a lot of mismanagement in his medical cares. So that's really what prompted my desire to be a nurse practitioner and be able to start helping people, hopefully in a better way, so they didn't have the complications that he did. So I became a nurse, and I started working in the NICU in 2013. And honestly, the NICU was amazing. Babies are treated a lot differently than adults in healthcare, and we really do. We take care of our children, and I absolutely love that job. But I felt like kind of stuck, so I wanted to be able to have more opportunities in the future for my family, for my schedule, working those long 12-hour shifts, night shifts, things like that. That was not doable with my family's schedule. So I decided to become a nurse practitioner. And when I became a nurse practitioner, little did I know that it was completely different than what I expected. Because when I started actually in a family practice, and even just in clinicals through nurse practitioner school, I started seeing how this wasn't really necessarily helping people. It was just putting band-aids on a lot of problems. And it was all about big pharma and medication driven. And honestly, it was dictated a lot by insurance. And I saw that, and it kind of put a, negative taste in my mouth. So when I was working in a family practice environment, insurance-based medicine, I saw, well, as a nurse practitioner, I was made to see, 10 to 15 minute follow-ups, 20 to 30 minute initial consultations. They wanted us to see 20 to 30 patients a day. And I became overwhelmed and extremely burned out really quickly. I also just in general did not feel like I was helping my patients. I felt like my patients loved me. And honestly, my managers probably hated me because I spent way too much time with my patients. And of course, they would, fill up my schedule, and that would get people behind. But ultimately, they felt listened to and they felt cared for, but I didn't feel like I could do what I needed to do to actually get to the root of their problems. And what I was taught through nurse practitioner school and clinicals, and, in the first year or two of working in those practices, was basically how to put band-aids on situations, not necessarily how to get to the root of the problem. So when I opened Redline Health and Wellness, I decided that I was not going to accept insurance because in my time as a family nurse practitioner, I determined that the main issue that was keeping me from actually making these patients healthier and better was insurance. There was a lot of red tape. Insurance would dictate how we practiced, what kind of labs we would order, what kind of medications we could order, what kind of imaging we could order. And I hated that. So I basically started a practice that was cash pay only so I could practice how I want to practice, not be ruled by insurance guidelines and protocols. So why does insurance versus cash pay matter? Basically, the huge difference is that as a cash pay practice and provider, I can spend time with my patients. I can spend an hour in our initial consultations, really going all over your medical history, really determining what symptoms are priority symptoms, looking at the full picture rather than just one problem at a time. And I can also order as many labs as I want. I am not ruled by what insurance decides they're going to cover or not cover. I usually in the very beginning, before you even start working with me, order a full metabolic and hormone panel because most of my patients are coming to me with those issues and we look at everything. You can't do that in an insurance-based care environment. So that's how it's different. I can order whatever I want. I can spend as much time with my patients as I want, and I can actually get to the root of their problem. Okay. So I hear from people all the time that they have talked to their OBGYN or they have talked to their PCP about their issues. And they've basically given them, well, you can start an SSRI or you can start birth control or you need to exercise more and eat less. And with what I hear from my patients is that also there's a ton of patients that come to me and tell me that their provider won't order a vitamin D level. Their provider won't order more thyroid tests than just a TSH, or their provider won't even order them hormones. In fact, I've had a patient that was told by their provider that they ordered their hormones, and I looked at their labs that they got. The provider said that their hormones were normal, but their actual labs had 0 hormones in them. So I feel like a lot of patients are being gaslit. I feel like they're being lied to. And that's when they work with me, that's what they feel is different. They also just in general feel listened to and feel like they weren't rushed through an appointment. And they feel like, okay, I actually have something to look forward to. And they feel like it's not just all in their head, or that they don't have any other options but taking an SSRI or birth control or something else. I think one of the main things that I am unwilling to compromise on when I'm providing care to my patients is time and the ability to actually make a relationship with them, the ability to ask them the deeper questions and actually listen to them. So a lot of practices will say you need to see more to make more. And I'm just unwilling to compromise on that. So I like making relationships with my patients and I like spending time with them. I want them to feel heard. I want them to feel like they can trust me. And time is what is required of that. So that has been one thing that I have been unwilling to compromise on. When I have more time to spend with my patient, I have the ability to ask them the deeper questions, to get them to basically actually tell me the real problems of what's going on. Because a lot of people go into the doctor or to the doctor's office, and they just say the surface level things of what's going on. But when you have time to actually talk to a patient like they're a human, they start opening up to you about more and more. And you realize that their problems are way worse. And honestly, that helps me because I'm able to connect far more dots and help them in a much better way. I think when building this practice, and I've been open for 3 years, so the 3 years that I've been in this practice, one of the most meaningful things is seeing the transitions of people and being able to witness that in real time. And granted, all of my appointments and everything are all virtual. I own a virtual practice, but to be able to see a patient from the very first day that they saw me and all of their symptoms, and you can see it on their face. You can see it in the appointment, how just worn out they are, to the 6-month mark or the 1 year mark, and how much of a different person they are. Like, it's just so, it's probably one of the most rewarding things that I get in my practice, because I actually feel like I'm making a difference. Whereas when I was in the insurance-based healthcare field, when I was in a clinic that, a family medicine clinic, I didn't see that. And it's different now. And it actually makes me excited to get up for work every day, to see a new patient appointment, to, just be able to witness their family changes, their marriage changes, their motivation and drive for life changes. Like, they might start a business, or they might they might feel better. How do I put this? They might enjoy their kids more. Like, just little things, but little things that are also such big things. To be able to witness that is just the best feeling in the world. When you're discussing like health in general, it's easy to just talk about the surface level things, not talk about the deeper things, the more vulnerable things of your life that you might not even share with like a friend or a family member. And it's only what you and your household, or maybe just you, know what's going on. And I really try to dig, and I know those things are vulnerable. I know it's hard to talk about it. Things like erectile dysfunction or low sex drive or depression, like, that's a hard thing to admit for a lot of men and women. And so I try to reframe it in a way that, I try to talk to them like a friend, and I try to get them to understand that if you don't tell me these things, I can't help you with these things. And I, I'm sure there's better ways that I could do it, but at the end of the day, they wind up opening up to me, and I treat them like a human, and I ask them more specific questions rather than just, do you have low sex drive or do you have erectile dysfunction? We go deeper, and I describe what that would be like. And then they're like, oh, yeah, I actually am having that. So, I try to reframe it into a way that they can understand. It's not just big medical words, and in a way that they're, the things that they're experiencing on a day-to-day basis, they can explain that to me. I let them explain it in a way that feels less sterile and clinical and more human. So I do a lot of education with my patients. We talk about nutrition. We talk about exercise. I dive into what type of exercise are they doing? What does their day-to-day diet look like? What does their sleep look like? And what does their alcohol intake look like? And I ask them to be honest with me about it. And then I educate them about what that's doing to their body and how it's going to affect their progress overall. And then I give them resources to change that. And I'm not the best at tough love. I'm a kind soul at heart, but at the end of the day, some people need that. And I try my best to try to give them what they need to motivate them and to encourage them. And I think I do a lot of that through just education. So I'm just a girl. I'm just a Texan girl, and I love my family. My priorities in my life are faith and family. Those always come first. And that's really what I want to be known for at the end of the day, is how important those things are in our lives. And that's just, to put it easily, that's who I am. My own life has shaped the way that I care for my patients because me and my husband have walked through the same issues, whether it be weight gain, obesity, terrible metabolic health, alcohol overconsumption, poor sleep, low sex drive. We've walked through it all, marriage issues. And so when I am treating my patient, I want them to know that these are normal things. And we don't want them to be normal things, but it's just how it is. But there can be something that helps you. There can be things that can transform your life if you invest in it, if you give it the time and the discipline to get there. And it's not a linear it's not a linear journey by any means. I know that for a fact, just from my own life. And my husband knows that from his own life. So but you got to start somewhere. And I approach my patients knowing that I've been through these things just as you have. And you don't have to hide anything from me. And I can give you all of the education and the resources and the tools that you need to get to a better life at the end of the day, because that's ultimately what I want for everybody. I just want everybody to live a higher quality of life. I want them to feel good doing it. I want them to have energy to play with their kids. I want them to have the confidence that they need to get more opportunities in life and just enjoy life. Faith has influenced how I practice and has influenced my practice in general, just because I am always going to stay true to my morals and my own values. I'm never going to let the entrepreneurship, way of thinking overcome my values and my morals. And I'm always going to stay honest. I'm always going to stay transparent. I'm always going to stay kind. And I think that has influenced my practice and just the way that I, treat patients too. My faith impacts the way that I view people and the way that I treat people ultimately. As far as a specific transformation story, I have so many transformation stories, but ultimately the one that I love the most is my own husband's. He started at 285 pounds, was depressed, was anxious. He was drinking way too much alcohol, eating way too much fast food. And this was just 5 years ago. Internally, he was probably miserable. And when we dialed everything in, we got his thyroid optimized, we got his testosterone optimized, we started him on a GLP-1 peptide, and he really started using those tools to his advantage, in the sense that it gave him motivation and drive to get out there, to exercise 5 days a week, to start lifting weights, to change up his diet. And honestly, he's my most successful transformation, because I just the difference that I have seen in him, in his mindset, in his faith, in his physical health, is just insane. And I'm not going to take all the credit for it, but you know, he's done like 80% of it, but it's amazing progress. So I love it. I always use him as an example. Oh, it's impacted our marriage significantly. He actually has the energy to come with me to go to the kids' things, and he just gets up every day with more motivation, and he's happier, he's less irritable. It has impacted our communication in our marriage. It's improved our sex life. Like, there's just so many positive benefits of it. And not only that, but he feels super confident, and he and confidence in a man is super important. If a man doesn't have confidence, everything else is going to dwindle. And so they need to feel respected, but they also need to be confident. They need to have the energy to be able to accept the love that they're, being given. And I think that's how, like, a huge part of how it's impacted our marriage. So if a person comes to me and just says that they feel off, something's going on, maybe they've talked to a doctor before or something about it, and they just, they don't know, but they know they feel different compared to when they did, 2 years ago or 5 years ago or 6 months ago. What I'm going to tell them is they need to get their labs done. And oftentimes they say, well, I got my labs done with my PCP a couple months ago and they said everything was normal. And I'm like, your PCP doesn't get the labs that I get. We need to dig deeper, and we need to look at your vitamins. We need to look at your hormones. We need to look deeper into your metabolic health and really put all the pieces together, because there's so many people out there who are suffering and basically just blaming it on age, which I hate hearing. I always tell my patients, because they will say, well, I have this and this, but I'm also getting older. And they're like 32 years old. And I'm like, no. You cannot say you're just getting older, because I have seen amazing transformations from somebody who was 30 and is now 40, and they are a completely different person. Age does not matter, obviously, to an extent, but you can optimize your health no matter what age you are.